Hey, it's been a couple months since we did one of these vlogs. It's been a really interesting journey and experience, and I've got a lot of updates to share with you folks. If you are new to this series, if you haven't heard of the Spondy vlogs, congratulations, you are now part of medical history. A quick recap, last year, as an active rock climber with a little bit of low back pain, I went into my doctor and I got an x-ray, and as it turns out, my back was broken in half. A condition called Spondylolisthesis, or Spondy for short. And I met with several surgeons, got a lot of opinions, did a literature review. If you are unfamiliar, is something in the academic world where you look for scholarly articles or papers around a topic and organize them such to become more well-versed in that field. I set out to make this vlog series because this is a condition that is quite common, and the surgery that's administered is problematic as I see it. It has limitations, it's expensive, it's dangerous. And I was talking to folks in the community suffering from Spondy about this rare approach of curing this condition without surgery, and nobody knew what it was. No one could talk to me about it. And so I decided, for better or for worse, let me be the guinea pig, let me experiment and publicly upload this. It doesn't work, at least we all know. If it does work, that's amazing. And so far it's worked, actually. Ironically, I was actually just in DC for an award from the National Academies of Science, Engineering, and Medicine for a totally separate reason, but it was really good timing because I got to talk to a lot of folks in the academies, in these traditional research institutions, about the treatment. And so I'm really excited because obviously I'm looking forward to fixing my back without surgery. But what I really think needs to happen now is we need larger human studies of this treatment so that it can become the common practice. There's a lot of upsides on this approach as opposed to spinal fusion surgery or megabone. And so I'm excited to be part of the forefront of advancing orthopedic research. Okay. My three quick updates: insurance, my treatment in Georgia, which was the last update, and then a combination of new therapies for dealing with the symptoms and perhaps even facilitating the rate of recovery for folks with this condition or other orthopedic issues. Here's the deal with insurance. Anybody could have predicted it. They have been terrible. They have refused all of my appeals to cover the complex traction therapy that is, as proven by x-ray, actually working and fixing my back. They just said, no, we're not going to do it. I have appealed up to the maximum level that insurance will allow, and now my only option is to appeal to an independent third party. So I will keep you guys posted. I'm not super optimistic. Insurance in America is not a great institution. They also refused my secondary MRI. So I have x-rays showing that my bones are shifting back into place, and my team thought we should get another MRI, look at what's going on with the soft tissues, with my disc, with my ligaments, and insurance says, why would we do this? So I'm gonna have to appeal that as well. So my trip to Georgia, which ended last year, just a few months ago, was very successful. Just for reference, when I was first diagnosed, we saw about 20 millimeters of forward slippage of my vertebra, of my L5 vertebra, and I left Georgia sitting at about 12 millimeters. That's an 8 millimeter reduction, or almost 40–50% of my spondy actually reversed, according to x-rays, which is huge. We were hoping to achieve more slippage than that, and I'll show you guys this in the x-ray. The challenge that we are currently facing is it seemed like my body didn't want to go further. But for frame of reference, the first person treated with this approach, it took about a year to reverse their entire spondy. And we did this in about 6 days. So we are definitely breaking new boundaries in terms of what is possible. And I don't think, in retrospect, it's not that surprising that we hit a wall in terms of progress. So we decided collectively, hey, let's pause, let's give everything time to sort of settle in, and the plan is to resume in a few weeks. I have another really exciting update from the Georgia provider, Dr. Fedorchuk. As I have told him and the man who manufactures these custom tables, this is going to need a different approach if we want to scale this up to be widely accessible. Most people don't have the time or the resources to travel all the way to Georgia, in order to receive this treatment, which can take days or even weeks. So they're working on that. They're creating custom home use tables that you can basically do self-guided with the assistance of a provider like Dr. Fedorchuk. This is awesome. I think this is the direction we need to go in. And I will actually be the first person to receive a prototype of one of these tables, hopefully within a few weeks, and that's when I'll resume my treatments. So this is really huge. So just as a reminder, Spondy is a relatively common condition on a global scale. And the only recommended treatment is PT to eliminate symptoms and spinal fusion, which I made a whole video of why spinal fusion is problematic. You can check it out. So this is huge, right? We're talking about a complete innovation for fixing this relatively common condition that is non-invasive, that poses few, if any, of the same risks, can be done a lot faster, and is just generally safer. So I'm really excited to be part of that history. Last update is I've been investigating more about combination therapies that could facilitate the process of recovery, and some may actually be separately useful to treat folks with less intense conditions of degenerated spinal issues, such as Spondy. One of those is PRP, or platelet-rich plasma. This is in the field of regenerative science, and there's a lot of info on it. So I can't summarize the whole field, but I will say, in essence, this is taking a blood draw from you and running that blood into a centrifuge, which spins down that blood to isolate the platelets and growth factors that your body naturally produces, and then directly injecting those into a target area that has an injury as a way of facilitating the body's normal healing capacities. This is a really exciting field because the body struggles to heal areas that lack direct blood supply. Connective tissue is one of those tissue types. And so PRP is a way of getting healing that would ordinarily take a long period of time to happen in a shorter period of time. The major logistical issue is that PRP is not covered by almost any insurance. There's a lot of reasons as to why. Again, insurance is kind of the devil. But that is a huge barrier of entry. There are a few clinics that provide affordable PRP. Since insurance doesn't cover it, it's just not on the table for most people. Also, it's still a new field, and there's pretty high variability in terms of the results, recommendations, and even how it's administered in the lab. It doesn't have the same stringent protocols as more well-established treatments. The other field, which I'm super stoked about, this is shockwave therapy, and it sounds like malarkey, okay? Shockwave therapy is sound wave-based healing. Again, I feel like I'm just talking about voodoo magic. So shockwave therapy was actually invented in the 1980s. It was originally used in the field of urology to break up mineral deposits within the body, such as kidney stones, and it was very effective at doing that. And over time, researchers sort of discovered by accident that it also had a lot of orthopedic applications. For one, they found that it was stimulating bone cells in animals during testing, and so they started to investigate. This is a really commonly used method of treating sports injuries. In other parts of the world, it's not so common in the United States. You guessed it, because insurance doesn't cover it. Why? Again, they are the devil. Okay, one thing that I found very fascinating in the field of shockwave, because it's a big field, it's really a burgeoning field of treating orthopedic injuries, and it can be used for tendinopathies, it can be used to fuse bones that have unsuccessfully fused together, such as with a major bone fracture in any part of your body. It can be used to address certain types of neurological pain. And so it's a really exciting field because it really poses very few risks. There are very few adverse events, as providers would call them, in terms of, yes, we did this to treat your tendon, and oh no, now you're dead or your arm fell off, right? It's a relatively safe treatment. It's not too expensive, and it doesn't take very long. And so one research article that I found, this was back in 2021, orthopedic group was looking at lab animals, and they were intentionally degenerating the discs in between their vertebrae in their spine as a way to test, can we regenerate these discs? This is a huge question that orthopedic science has yet to answer. How can we regrow intervertebral discs? We haven't really come up with a good way of doing that. And what they found is if they degenerated the disc in the rats and they used shockwave therapy in conjunction with low tension traction, and traction is just pulling, creating a separating force between the vertebra or across your spine, the two of those treatments in conjunction with one another did significantly regenerate the discs of those rats. Those poor rats, they were all killed in the name of science, but they even did tissue dissections to analyze the types of collagen, the method of regrowth, and basically the quality of the discs. And they had 5 different groups, and those that received shockwave and low tension traction had the best outcomes. So I am currently the first human lab rat to attempt shockwave therapy in conjunction with regular traction. This is something that, even though I'm not seeing the provider in Georgia for the table that can actually reverse my spondy, on about a 2 to 3 period time per week, I am performing low tension traction on my own spine because there's plenty of literature that supports healing and supporting regrowth of the discs from just traction. You can simulate this in a easy environment like hanging on a pull-up bar, and as of 2 weeks ago, I have started shockwave therapy. And this is the biggest thing, and I'll leave you with this because the next installment of the vlog, we're gonna talk in more detail about the Shockwave Clinic. And y'all, I have gone for 2 treatments. They're about 30 minutes each, relatively simple. And this past Monday, I went in, and to be honest, I had previously been dealing with a pain level of probably 4 to 6 on a daily basis. Just the act of sitting, standing for long periods, just holding my body, let alone if I had to carry a bag, it was just grueling. It was tiring. Like, I think if you're watching this because you have Spondy, you probably know what it's like. Like, literally just existing is painful and it makes everything hard. And I walked out on Monday, I went down to like a 0. Like, absolutely insane. The long-term regenerative benefits of shockwave therapy probably take several weeks or months, but what I didn't expect was to actually walk away feeling almost symptom-free, and this is after 2 treatments. Absolutely insane. Like, I have not found anything that replicated that. So that's kind of the big picture, y'all. I'm gonna continue to do shockwave therapy and then seek a follow-up MRI so we can actually look at a comparison of my actual back as I continue to explore all these non-surgical treatments. The last thing I would like to say, I'm excited to see folks really catching wind of this and seeing that there's a lot of validity behind this work that Dr. Fedorchuk is doing. They are going to publish their 300-person case series on these Spondy outcomes, all of the folks that he's cured and treated with this condition. I'm excited to support them with that. And the last thing I would say, if you have Spondy, I would like to talk to you. I wanna open this up because it's a community of people that deal with this issue, and I have certainly felt more hopeful, more optimistic, and encouraged by talking to other folks with Spondy who have gone through treatments than just dealing with it in isolation. So thanks for watching. Hope to see you next time.